Greetings, everyone. Today I'll be talking about navigating the labyrinth, addressing healthcare system challenges in India. India stands at a crossroads in its healthcare systems, grappling with multifaceted challenges that hinder its ability to provide equitable and accessible healthcare to its vast population. From inadequate infrastructure to disparities in healthcare access, the country's healthcare landscape demands urgent attention and comprehensive reform. In this video, I'll delve into the intricacies of India's healthcare system challenges, explore potential solutions, and navigate the barriers to their implementation. Let's talk about the current landscape first. So, India's healthcare system is characterized by a stark contrast between urban and rural areas, with disparities in access to healthcare facilities, skilled medical professionals, and quality services. Despite commendable progress in recent years, key indicators such as doctor patient ratios, hospital beds per capita, and public health expenditure remain below its international standards. Talking about challenges, we first have infrastructure shortfalls. Insufficient healthcare infrastructure, particularly in rural areas, leads to overcrowded hospitals, long waiting times, and compromised patient care. The shortage of hospitals, clinics, and medical equipment uh, st- um, exacerbates the burden on existing facilities. Then we have human resource crisis. India faces a severe shortage of trained medical professionals, including doctor, nurses, and paramedics. The skewed distribution of healthcare workers, with a concentration in urban areas, leaves rural populations undeserved. Additionally, issues such as brain drain and inadequate training programs further exacerbate the scarcity of skilled personnel. Third, affordability and accessibility. High out of pocket expenses deter many Indians from seeking necessary healthcare services, pushing them into poverty. The lack of comprehensive health insurance coverage further compounds the financial burden on individuals and families, especially during medical emergencies. Quality of care. Disparities in the quality of healthcare services persist across different regions and healthcare facilities. Inadequate regulation and oversight contribute to variations in medical standards, leading to suboptimal patient outcomes and eroding public trust in the healthcare system. Now we'll talk about what are the measures that we can take. First, we should invest in infrastructure where the government must prioritize in this and particularly in undeserved rural areas. This includes building new hospitals, upgrading existing facilities, and deploying essential medical equipment to enhance the delivery of healthcare services. Second, strengthening the primary healthcare by in disease prevention, early detection, and treatment, uh, which is crucial for improving healthcare access and outcomes. This entails expanding the network of primary health care centers, training community health workers, and promoting preventive care initiatives. Third, addressing human resource shortages should focus on expanding medical education and training programs, incentivizing rural postings for healthcare workers, and implementing effective retention strategies to mitigate brain drain. Fourth, universal health coverage. Implementing a robust universal health coverage scheme can significantly reduce financial barriers to healthcare access. By providing comprehensive insurance coverage and subsidizing healthcare costs for vulnerable populations, India can ensure equitable access to essential health services. Timeline for implementation. First, short term, 1 to 2 years. Immediate measures such as allocating funds for infrastructure development, initiating recruitment drives for healthcare personnel, and launching awareness campaigns on preventive healthcare can be implemented within the first 2 years. Second, medium term, 3 to 5 years. Over the next 3 to 5 years, effort should focus on expanding primary healthcare coverage, enhancing medical education and training infrastructure, and piloting universal health coverage schemes in select regions to access their feasibility and impact. Third, long term, 5 plus years. Sustainable healthcare reform requires long term planning and commitment. Beyond the 5 year mark, continuous investment in healthcare infrastructure should prevail. Barriers to implementation. First, funding constraints. Limited financial resources pose a significant barrier to implementing comprehensive healthcare reforms. Second, political will. Political considerations and bureaucratic inertia may hinder the timely implementation of healthcare reforms. Third, resistance to change. Resistance from vested interests, including healthcare providers, pharmaceutical companies, could impede reform efforts aimed at restructuring the healthcare system. Thank you.